Hi, my name is Haley Potter. I'm going to be talking about grandparents raising children. I am a current MSW student here at WSU, so this topic is very prevalent to the work that I do in every day. So that's why I'm feeling so passionate about it, and I'm excited to share some information with you. So, a little bit of background. There are many possible reasons for why grandparents would be the guardian. It's really just case by case basis. Some examples of those could be overall termination of parental rights. There could be court ordered temporary housing for the child for multiple reasons, could be drug and alcohol related, domestic violence, etc. There is an estimated 13 million households currently that have grandparents as the guardians. That means that there's approximately 2.5 million grandparents every day that are taking in children to raise as their own, which is a ton. But the plus side of it is that it's very important to keep that kind of family permanency when displacing a child from the home. So for many different reasons, such as like cognitive development, can be potentially stunted if a child doesn't feel safe and supported in a temporary housing, such as like foster care. So having the grandparents raise the children as their own is a very beneficial possibility. So some strengths, like I just mentioned, it keeps the child within the biological family. So that allows them to maintain those positive relationships that they've already built with their grandparents. So it's easily adapted. Um, the grandparents are a stable housing. You're familiar, for the most part, with what kind of goes on within the household already. They are good, positive role models for these children because they had already raised their own children. They've kind of been through it before. So on the flip side of things, there are some challenges that accompany having grandparents raise children, such as the physical limitations of older adults, especially depending on how old the children who are entering the home may be. This could be more difficult for them. There could be an overall lack of authority that accompanies that for the children kind of transitioning from this is my fun grandparents' house into like this is my household now, and that kind of like respect aspect that comes along with that transition. The overall change in family dynamics is going to be a big challenge for the kiddos and for the grandparents as well. Not to mention financial implications that are now going to be placed on the grandparents for raising children because children are not cheap. Along with just kind of relearning some important parenting skills that they might have lost along the way, depending on how long it was before their children moved out of the home. So some problems that impact some family members. It could be challenges with relationships with the parent after the removal of the child. There could be some resentment that kind of ties along with that. Managing the increased responsibility of having children in the home can be a potential problem. Along with that, the possibility of conflict in the family and in the marital relationships. It's likely that adding child back into the home can cause stress and strains in the marriage. There is concern for the children's development after removal for the parent and transitioning into a possibly like less focused parenting style. Some problems to address would be the retention of placement. Keeping the child within the biological family is always the first response when a child needs to be removed from the home, but making sure that that home that they're transitioning to is appropriate and is able to adapt that child is key. The screening process for potential homes needs to evaluate the grandparents' possible physical and mental limitations before it's even considered a viable option. The level of support available to the family, clinical agency, community, whatever it may be, and the responsiveness of the case team. And then just treating the families with respect, valuing the insight that they bring and not always thinking that foster families are attempting to sabotage reintegration. That might be a more viable option if those previous mental and physical limitations are prevalent in this case. So some possible intervention options after that child has been placed into a home with grandparents, kind of that adapting and all moving forward. Of course, this isn't all of the options available. These are just a couple that I had considered. Would be traditional family therapy or ongoing individual therapy for the child, along with the grandparents to address possible like adjustment disorder, anxiety, depression, PTSD, etc. Like moving from your primary home into any home is going to be a big change, and that needs to be addressed. The intervention that I did select was the traditional family therapy, because it kind of integrates the motivational interviewing along with CBT therapy, role play therapy. So it kind of combines all of those that you would be getting in the individual therapy into one kind of cohesive unit. It's an evidence-based therapy option, and it comes with live therapy approach, meaning that like the grandparents and the children are going to be together. It'll teach the grandparents how to increase communication skills that might not be helping in the home. It'll teach de-escalation techniques and just kind of reform those family dynamics. Traditional family therapy has shown to reduce behavioral problems in children and increase the use of positive parenting techniques within the parents, or in this case, grandparents that are attending the family therapy with them. So family therapy can help to increase those positive relationships between the grandparents and the children in the home. It can help teach or reteach the grandparents important skills that are tailored to this individual situation. Family therapy can allow for grandparents and the children to express frustrations and hesitations that they may be having at home in this safe environment, with a professional there to kind of help navigate them through these difficult situations. Family therapy can also connect the grandparents and the children to additional supports outside of their home or outside of the therapy that may be needed. It can help teach methods and continue that can be continued within the home. So kind of just wrapping things up, having grandparents raise children can be a very beneficial option for healthy development of these adolescents. While there are many possible limitations that can arise when having grandparents raise a child, this option keeps the child within the biological family, which is so important for their development. With the use of family therapy as a requirement for these transitional homes, the grandparents and the children can continue to work and build those positive relationships, the parenting skills, communication skills, and help build support systems. With the implication of the traditional family therapy, it is likely that the child will remain in the care of the grandparents until further noted with continual cognitive growth, meaning that there shouldn't be any stunt in their development if this is a temporary housing position. And if it is permanent, this should be able to be a cohesive, adaptable change. Thanks for listening.